Hi, we're going to do a short video on remote patient monitoring. Remote patient monitoring is new and exciting because the federal government announced in January, prior to COVID actually, that they would begin paying for remote patient monitoring. I'm going to refer to it as RPM at times. Um, and frankly, I think remote patient monitoring provides the physician a new tool on helping patients in these complex times and allows you to monitor complex and chronic patients and track patient care. So really, remote patient monitoring allows you to have another tool to bring revenue into your practice during COVID. It allows you to monitor and treat complex conditions during COVID when maybe you don't want to bring high-risk patients into your practice. And there are a lot of clinical and economic reasons to embrace it um, uh, during this period of pandemic. Um, and obviously, physicians are facing incredible risk and complexities that I've outlined on this slide right now during this period. Volume reductions have been real, and this allows you to figure out ways to bring in additional revenue. But more importantly, perhaps it really does allow you to monitor those complex patients without bringing them in and creating exposure of risk to you or to your patient. So let's talk a little bit about what this actually is. So as we change healthcare and move away from volume-based to value-based payment, CMS is looking for more tools where you can be incentivized to take better care of the entire patient. Remote patient monitoring is becoming a component of that, resulting hopefully in better patient outcomes and higher satisfaction. Given the fact that chronic illness accounts for 95% of all Medicare spending, CMS believes there's a significant opportunity to reduce healthcare costs by improving care management for these complex patients. The introduction of these new billing codes is intended to really encourage physicians and other healthcare providers to invest in remote patient monitoring and care management, and to compensate physicians for the time they spend between the appointments helping patients stay on track with their complex treatments. Different examples of devices that are used in remote patient monitoring can be a blood pressure cuff, a glucometer, pulsometer, weight scale, and really more and more we're seeing all kinds of different remote patient monitoring devices. Things that measure everything from opioid prescribing monitoring for pain management docs to measures like the glucometer and blood pressure cuff, which might be used for someone with heart issues or maybe different other devices aimed at diabetes. But there's all kinds of opportunities and all kinds of companies offering these opportunities. The codes that were created under Medicare that began being paid in January include the CPT Code 99453, which is the initial setup and patient education, so patients understand how to use the device. And a lot of times these devices are very simply part of an app on an Android or an iPhone, and the devices work in coordination with them. The practice can also bill for 99454, the supply of devices, daily collection, transmission, and report of the services during the 30 days. They can bill for 99457, which is remote physiological monitoring, treatment management services by clinical staff, physician, other qualified healthcare professional for the first 20 minutes. And then each additional 20 minutes gets billed under 99458. That's kind of the care management component of this. So those are the CPT codes under Medicare that you can bill. Now, a lot of you guys are probably thinking, wait a second, I don't have this kind of technology. Well, fortunately, or maybe unfortunately, there are literally hundreds of companies across the country that are coming out with different remote monitoring products. So we would strongly suggest if this is something that interests you or something that you want to do, contact Maryland State Medical Society, MedChi, to learn more about remote patient monitoring. And this is an opportunity to make more money in your practice and to improve care for those chronic condition patients. We've heard varying degrees of success with different companies. So we'd really like to to have a discussion with you and help you make the right choices on all kinds of issues, from contracting to cost. A lot of times the companies will provide all the services and then they expect a portion of the payment. Other companies are doing it in different ways, but we can talk through those things. And if you reach out to Andrea Mullen or Barbara Fitzgerald, they're happy to get you some more information and go through some choices for you and your practice. As always, MedKai appreciates being your advocate, your resource for the physician profession. So please reach out and let us know if we can help you with remote patient monitoring or anything that your practice might need.